So you have explained it to the patient. You don't have to get any kind of consent or anything signed for an IV. Put your tourniquet on. If you guys aren't sure how to put a tourniquet on, please figure it out. I do mine this way. I cross them over and hold the right side of my tourniquet in my left hand, and then I press that against whatever arm or whatever I'm using. I pull hard with my right hand and then cross it over, and then catch it with my thumb on my left hand and then tuck it under. That's how I put on a Foley. That way, a tourniquet. That way I can just pop it and pull it. So cross over, pull it tight, tuck it under, and then you're ready to go. So then you would find your place where you want to stick. Of course, yeah, it's hard not to know where to stick this one. And then Archibald says that you should find your spot and then clean it. And it has to be cleaned for 30 seconds. So you have to play the Jeopardy song in your brain or sing happy birthday or whatever you got to do. Ooh, he's a mess. And then you would pop your tourniquet and let it air dry while you complete getting your stuff ready. So you would get your pigtail flushed through. And of course that would have a cap on the end of it. So you want to loosen that cap, because if you don't, you're going to have to be doing this one-handed in just a minute. So, because this hand's going to be busy. Kind of like doing your Foley. This hand's going to be busy, so you've got to be able to get that cap off. So you want to loosen it to make sure that you can get it off. And I'm just going to simulate with this. That's not what it would actually look like. Then you want to get your catheter out and ready. What else do I need?
Tape.
Tape.
4x4. And you would have your
Tegaderm already open.
yeah, the Tegaderm thing.
Okay. So Archibald is saying that we should tape this to our glove. I'm trying to learn how to do it.
That seems like it would be hard.
Yeah, like I said, I'm trying to learn how to do it their way. We'll see how it works. And then I would open this and have it ready to go. We're not actually going to use this.
So that's huge.
I'm going to take it out so that it's out and ready to go. So then I start thinking, okay, what order am I going to need stuff in? Just like when I do my NG tube, I know I'm going to need this first, then I'm going to need this, and then I'm going to need my tape, and then I'm probably going to need these pretty right quick after, because it's going to bleed, and I've never put an IV without making a huge mess. So now I'm ready to go. Put my tourniquet back on and get ready to stick. So catheters come in different sizes. Blue is always a 22. Remember, you want to stick with your bevel up, and then there's on the back side of your catheter here is the place where you can hold. It just kind of gives you more control. It's got ridges on the side, so when you grab a hold of it, you should be able to feel those ridges so that you'll know you're holding it correctly. It also lets you know that, because if I hold it this way, my bevel, there's no way my bevel is up. So if I'm holding it side to side, my bevel is either up or down, so now I just need to look and double check that it's up. On these, of course, like I said, you got to go in at a pretty steep angle. On a real person, you won't go in not near this way. So you break the skin, you get flashback. Oh, we turn my blood on. Pop those two. So I get flashback. You want to drop your needle down and advance just a little bit further, because remember, just because you got flashback just means that the tip of your needle is inside the vein. Remember, the needle stuck out past the catheter, so you need to drop down and advance just a little bit further so that the end of the catheter is inside the vein. So then once you do that, I stabilize the hand that's holding the needle, and I don't let it go any further, because if I do, the likelihood that I'm going to puncture the back side of my vein is great. So I stabilize this hand, I pop my tourniquet, and then I thread off my catheter. That makes sense? Okay, so it was like this. I hold this hand still, and I thread off my catheter into the vein. Okay? Now, I can leave that there because this needle will occlude that thing for just a few minutes for me until I get this ready. So I do this. I pop this and I have this ready to go. I hold tight. Only one drop this time. That's pretty good. I'm getting better. And then I pull back. See that I've got blood return, and then flush. And you can do one of two things. You can leave your syringe attached. You can take it off. You can do whatever you like. At this point, I usually say to my patient, hold really still until I get this tape down so I don't have to do this again. Most patients, very happy to hold really still for you while you get this taped into place. Tape goes underneath. Lift up on it. You want your tape to be on your catheter, not on your fluor lock hub. So you want to do a U. And the reason you want to do a U is because you want to leave a window open. You're like creating a frame, if you think of it that way, down that vein. I want to be able to see that vein all the way down where I've got that catheter in, so that if it starts turning red, I can see that. Okay, and then I would put my tegaderm, you peel this back off, it'll leave this edge around, and then this will stick onto the catheter only. Snug it up good around it, and then put it down over. Don't tape it to this, because see, at this point, if I needed to, like if this got damaged or whatever, I could take this off and put a new one on if I had to. Okay. So without having to restart an IV. So there's that. And then I would, my one more piece of tape, make my pigtail. Remember how I do this little, wrap it around, and create that little loop so that if it gets pulled, it's not pulling on this, it's pulling on this first to remind them, oh, my IV is stuck on something and I need to get a hold of it. It also makes it so that when you come in as a nurse, this isn't taped to the skin. And there's nothing that irritates me more than the people who do this right here. Take a big old piece of tape. Uh-oh. This is my tegaderm right here. And they take this and they tape it over the tegaderm and over this as tight as they can into somebody's skin. And then when you come in, you got nothing to work with because it's too tight. You can't get under it. You can't get connected. It's probably digging a hole in their skin. And now you're taped to your tegaderm, so you can't get the tape off without messing it all up. So, don't be that nurse that I'm fussing at coming in behind you.
Will you tape that again?
Yep.
Sorry, let me just...
So I take a big piece of tape, wrap it around, kind of like when we're doing those, and then tape it to the skin this way, so that now you've got
Yeah, got it.
like a little.
Is there a certain amount that you flush with? Like, is there like a set amount that you want to?
If I'm just putting an IV in, I usually flush with 5 to 7 milliliters. This is what we used to get. I mean, it used to be a 3 cc flush. That was all you got. So I don't think there's like written in stone how much. But when you flush, don't be like this. Yeah, we don't want that. When you flush and you make sure, you can be like that the first little bit while you're making sure, is it working, is it leaking, that kind of stuff. But as soon as you know, okay, yeah, that IV's okay, flush it, because you're trying to get yuck cleaned out of the end of that thing. And the only way you're going to do that is with some force and some velocity going through there. But yeah, so do it slow when you're assessing the site to make sure that you're in the vein. But then after that, give it some push so that it's clean. And remember, for positive pressure, as you're pushing, you want to be clamping off so that the blood doesn't backtrack into your catheter and clot it up. Okay? Questions about that?